Good morning, everyone. And I'm sincerely thank each and every one of you joining here today for our expert session. And yes, today's session is like curated for the clinical medical physics and for the ethics perspective. And our speaker, Sriram Rajukar, is our radiation oncology medical physicist and is currently serving as an assistant professor in Department of Medical Physics in NIMS University, Jaipur, India. And with a strong academic and foundation and research oriented career. And over these years, and he has been actively engaged in developing AI assisted tools, especially for workflow automation of radiation oncology department, contributing both clinical innovation and academic growth. And he is an aspiring professional focused on AI ethics and responsible technology, and is still pursuing another master degree in global health and human development for AI Ethics Foundation. And he has completed a professional course in AI ethics from University of Helsinki, and also he also holds a degree in diploma in e-governance. And he has successfully completed an international internship in data science and machine learning in radiotherapy at a German cancer center, Heidelberg, Germany. And he also published a patented several peer-reviewed articles and international conference proceeding also. And he is working as a scientific writer and contributor to a physics world in Bristol, UK. And yeah, he more than that, he has recognized with numerous national and international awards, like Academic Excellence Award in 2023 in Lucknow for Python programming, and IUPAP SEOP Travel Award for 2024 Malaysia for Research Excellence, and this Professor Sung Sil Su AFM MP Best Students Publication Award for 2025. And very recently, he has acquired like AAPM Access Award for 2026 under the category of AAPM Early Access, Early Career Research Access Reward, ECR. And beyond academics, he has affiliated with the several NGO focused on cancer awareness program, aiming to bridge the gap between advanced research and public health education. And really, I'm thank you for joining us, Mr. Sriram Rajukar, and it is an honor to have you with us today. I now invite you to begin the today's session, and the stage is yours. Thank you. You can share your screen.
Yes, thank you, sir.
Yes, it's perfect. The screen is visible.
Okay, thank you. So, good afternoon to all of you. I am Sriram Rajurkar, currently working as Assistant Professor in Medical Physics, Department of Radiation Oncology, NIMS University, Jaipur, India. So today we will discuss about the AI ethics perspective, especially for the medical physics, and we'll discuss about will AI replace the medical physicist role in the era of artificial intelligence. So during this webinar or these sessions, we'll discuss about some introductory part about the AI, then what are the fundamental principle of the ethics, then what is the integrations of the AI ethics, and what are the principle, especially in AI ethics, then the role of the AI ethics principle for the medical physics, and most is an essential principle for AI ethics in medical physics practices. So, what is AI? AI is nothing but the integration of the computational science and statistics. AI in which the machine is mimic as the humans and it will provide some outputs. So there are different algorithm like the supervised algorithm, unsupervised machine learning algorithm, and deep learning, and so on. So I know that nowadays everyone is aware about the AI, their algorithm, principles, and how they are work in application in healthcare sector and all. AI is not a new concept. If we see after the decolonization of the India from the Britishers, later on in around 1960, there was some paper is also published, which is provide the application of AI, and then Python will start it integration of the and application of Python in AI. So it's just a fusion of two things, that is the computational science and the statistic formulas and statistical data sciences. Nowadays, we can see that there are numerous application of AI in all fields, especially in healthcare sector also. And if we focus on the application of the AI in radiotherapy, we can see the radiotherapy workflow that is start with the treatment decisions, then simulation, treatment planning, quality assurance, then the radiotherapy delivery, and last part is the follow-up. So there are so many paper has been publishing for the treatment decision that will help to decide the treatment modalities or treatment type, like the if you want to move towards the precision oncology and precision radiotherapy, the some genomic data, image data that will help to predict some uh, prognosis also. So that will provide a good predictive model that will help to improve the radiotherapy workflow. And integration of the AI in radiotherapy will enhance the quality of life for the patients. Next step is the image simulation. AI can promise to reduce the radiation exposure to the patient and enhance the image quality. Likewise, there are application we can nowadays we can create a synthetic city from the MRI images. So such a application where that we can reduce the exposure of the synthetic exposure of the CT scan by creating the synthetic city. So this is also one of the and application of the AI during the stage of the simulation. Then treatment planning, so contouring and auto treatment planning. See, all these things are under the trials, and up to GTV, we are getting a good result in the delineations. And nowadays, we have seen the some plan also, which is usable in clinical practices. Then next thing is the plan approval, quality assurance. AI is also integrated in the process of the quality assurance, treatment delivery. Nowadays, AI-based some application that can be integrated in DI-based technique. So there are so many applications during that is useful during the radiotherapy delivery. And next one is the follow-up. So based on follow toxicity prediction, and what will be the real-time meaningful clinical decision. So many studies are going on in the lung cancer, how degrading the tumor volume with respect to time, and which dose is suitable for. So such so many studies is going on, and that is help to predict the toxicity among the RT patients. So these are the several application of AI in radiotherapy workflow, like likewise the automation of treatment planning or auto segmentation. So
Sorry to interrupt, Sriram.
yeah,
Is the slide is are you moving the sliders? Still, we are on the first slide. What is AI? Is it okay?
uh,
Otherwise, I think
now
you're no. Can you reach?
yes, now it is visible.
Okay, fine. Shall we continue with this setup? Yeah.
Yeah, thank you.
Yes, please.
Yes. So till now we have discussed about the application of AI in the radiotherapy workflow, from the treatment decision, then the simulation, treatment planning, quality assurance, and follow-up of RT. Next, please. So there are one more applications of automation of treatment planning, like the auto segmentation. So AI tools is rapidly using for the delineation of the tumor organoids and over the CT scan. In head and neck cancer, contouring can reduce about the hours of the time, within the minutes, for the auto contouring. Next, please. And next application is automatic treatment planning. And automatic treatment planning, like the wherein ethos restrictions, they are using the AI generated models to prepare the deliverable treatment plans with the minimum human interventions. So there are so many studies are going on, which is applications of the AI in automatic treatment planning. Uh, Next. Also, there are application how the AI model can be used for automatically selection of the beam orientations and intensities, and eliminate much more of the traditional triangular approach. So this some algorithm can be useful for finding the optimal beam for the treatment plan. So these are the one more application of the AI in beam angle optimization. And AI also analyze the DVH and clinical data, then dosimetric data, and based on this data, they can predict the side effect and toxicity, such as the lung toxicity and cardiac toxicity. So, for developing such a model, need to input data from the clinical practices, dosimetric, radiomics data, then we can use the algorithm, AI based algorithm, and it will provide the output like the acute toxicity and late toxicity. So this is also the one of the application of AI in toxicity prediction. Yeah. Next, as we know, AI given the so many advantage, and it help to enhance the radiotherapy workflow. It will save our time, but there are some risk factors that we have to consider, like how, and there are some challenges of integration of the AI in routine planning practices. As we see, numerous papers are published day by day, but this much application is not observed in clinical practices. So reason behind this, there are some challenges, like the integration of this system in the hospital system. And if we, so many papers are published with single institute or a single country data, so it's not feasible to use this same model for the other countries or other territories, because the data is different, so it cannot produce that expected outcome for the different data set or the different region. So need the training and adaptation of the healthcare profession. So if we consider the past few years, that everyone is not familiar with how to run the AI models, how to analyze the data. So there need some training and how to use this application in practices. So there are lack of training and adaptations by the for the healthcare professional. We need the regulatory approval for application of this model or this tool in routine practices. So there are also some ethical concerns, like the bias, safety, data privacy, fairness. So we need all these ethical principles need to be implemented while training the AI models. And also the most important thing, that is the AI is a decision supporter, and with so this is a very fundamental and important principle for medical physics community is human oversights and need some infrastructure also. Next, there are also some lack of guideline for AI in RT, how to integrate, how to implement, and how to need some. We need some governance. There is a lack of such guidelines and governance, and we need to redesign some clinical trials to evaluate the appropriateness, accuracy, uh, safety analysis. So we need some evaluation, clinical trials to implement such algorithm, such a model in clinical practices. And and we have to distribute the responsibility of the AI model while integrating in the clinical practices. And there may be a probability of the black box, and we have to find black box is the concept when, for example, if we are operating some any algorithm or any model, you have given some input data and they are providing the output data, but you are not and you are not aware about how this data is generated, how this model is providing the output. So there is a concept of the black box. We should know how this model is working. Sometimes there are auto learn model are there. They will learn from themselves from the data and they will provide the output. So such a model will not be this much useful in clinical practices. There will be a risk factor of black box. Uh, Next, please. So to solving this issue, the concept is comes that is the ethics. Ethics is one of the branch of the philosophy that study about some moral principle, and it determines whether the what is the right, what is the wrong, what is the good and what is the bad in human behavior or the society. It provides some the ethical principle provides some frameworks, values, and rules that guide how the individual make the choice that fulfill the responsibility, treat one another in the society. If we think about the ethics, actually ethics is not a new for all of us. We already went through that process. We have seen the ethical principle in throughout our journey, but maybe this is not part of our syllabus, routine syllabus. But we are aware about the ethics. So now I will tell you one example. Next, please. So I have taken up this picture or one small clip part of one movie. I think you all are aware and you have seen this part where the one engineering student convinced the medical student for the medical emergency, and that time he talk about the one oath and next. And this oath is nothing but the Hippocratic oath, which show the responsibility of the doctors for the clinical practices. And in that oath, defined some ethical principle. So it is the fundamental part of the biomedical ethics, that is the Hippocratic oath. Next. And during the World War II also, there was a launch of the Declaration of Helsinki, which is completely focused on the other principle of the ethics and more concentrated on the informed consent. So participations of the human in a trial or the clinical practices, they ask for the informed consent. So patients should have autonomy and some other principles he have to follow that he can patient can choose the decision about the treatment, which treatment I would like to attain or should I go with this treatment or not. So such a benefits having the patient. Next. So ethics is having the three main pillars of the ethics, like the meta ethics, then normative ethics and applied ethics. For the medical physicist point of view, applied ethics is important because the AI ethics is the part of the applied ethics. Next, please. Meta-ethics is investigate the origin of the moral concepts, and it takes where the our principle is come from and where the moral truth are objective and subjective. So it is investigate the origin of the moral concept. So this is the part of the meta ethics. Then second part is normative ethics. It focus on setting of the criteria, rules, what makes the action right or wrong. This include the theories like the uh, utilitarianisms. So utilitarianisms is the ethical theory that state about what is the best action. If you are doing something overall, means these are concentrate upon the overall happiness of the well-being or the greatest do greatest for the greatest number. Next one. Next one is the applied ethics, and applied ethics is need for the current scenario, like the era of AI. That it examine the real world issues, like the application of ethical theories in specific fields such as medicine, law, business, and technology. So nowadays, AI ethics and applied ethics is working in application of AI in healthcare sectors. Next. The area of applied ethics, because of bioethics and medical ethics, in our India, for the bioethics, we are using the two guideline, ICMR guideline 2017 for the all biomedical research. And recently in 2023, ICMR launched the one more guideline, AI ethics, yeah, for the biomedical practices, like AI guideline 2023 for the integration of AI in biomedical research, and that focuses. So, area of applied ethics is focuses on the moral implications of the medical procedures, technology, treatment, and it govern the patient autonomy, informed consent, end of life decisions, and all. Next. This addressed the moral challenges created by the rapid growth of the technology. It include the managing the data privacy, then data bias, automated softwares, and what are the societal impact of these automations. So this comes under the AI ethics principle, especially concentrated on the technological part. Next. So these are the basic principle of ethics, like the autonomy, beneficency, norm efficiency, and justice. Next. So autonomy is representing the patient's right to make an independent decisions about their own health care, and its application ensure the patient give full informed consent before any procedure and allow them to refuse the treatment. If the patient don't want to start their treatment, they can refuse. This is the principle of autonomy in the healthcare. Next. Next one is the beneficency. Is acting is the best interest patient to promote their health. Means providing the effective treatment, offering the pain relief, trailing the care plans, maximum the positive health outcome for the individuals. Next. Non-malignancy, which the weighing of the risk factor and benefit in point of the medical intervention, that avoiding the unnecessary and overly painful procedure for the preventing the medical negligence. So this is the one of the principle of the ethics. Next. Justice is the ensuring the fairness, equity, and equality in medical care and distribution of the healthcare resources among the public and society. This is about the justice. Next. So now we focus upon the integration of the AI and ethics. So AI ethics is one of the multidisciplinary framework of the ethical principle. It is also provide the guidelines that decide that designed to focus to ensuring that the deployment, the journey of a journey from development to deployment of the AI is done responsibly, with considering the principle of the transparency and accountability, while promising the fairness and maintain the societal welfare while minimizing the harm throughout the process. So this is the principle of the AI ethics. Uh, Next. As we see the role of AI ethics in medical physics, as we see the technology is advancing day by day. So if anything is goes wrong, who will be responsible? For example, we prepare any plan and there is something wrong about the dosimetric point of view or treatment delivery, then who will take the responsibility? If the any model is developing, if there is some algorithmic bias, then the output will be unequal and treatment outcome will be a different, with respect to a different patients. And transparency and explainability is important because the medical physicist should understand how AI system generated the recommendations and the output which we can use in the quality assurance and treatment delivery. And this is important because all the application of the AI is directly influence and affect the patient care, and especially the cancer patients. So AI ethics is essential to ensure the safe and responsible clinical practices. Next. So there is some more guideline. There is IEEE, then the UNESCO, AU Act, and they have defined the different AI ethics principles. But yes, someone is speaking. Okay. So I have picked up the some more, and which seems to be essential in the in point of view of medical physicists. So there is around six AI principle, AI ethics principle. I am going to discuss here. What is the safety and responsibility, transparency, data privacy, and accountability, fairness, bias, and human oversights. Next. If you think about safety and reliability, we know that a small computational error or algorithmic error can lead to adverse effects such as the treatment failure, unnecessary exposure, or unintended exposure. So we have to consider and find out what are the strengths and limitations of the AI-based technology which we are using in radiotherapy. And this principle help to design the study. If you are the researcher, then it will help to design the studies and analyze the scientific validity, reproducibility, and clinical trustworthiness of the AI model. So safety and reliability is important in such a way that. Next. Next is transparency and explainability. If we are using any AI model in our team, so we should know how AI model is generating the output, how they are providing the output or recommendation. If any clinical AI model is operated with a black box, so it will provide the wrong output and which may be not suitable for the regular clinical practices. This helps medical physics to develop the critical understanding of the AI technology rather than just depending upon their output, how they are generated. So transparency, how they are working, and explainability, how this algorithm is work. So this is important for AI ethics point of view for the medical physicist. Next. Next one is ethics principle like the fairness and bias to prevent the unintended production of unequal or discriminatory outcome of the AI model. For example, if you have developed any model and you have taken some bias data, so output will be a bias and resultant and prediction will be a bias. So fairness and bias, this principle is important. This AI tool can train on the bias and non-representative data set, so they will produce the unequal and discriminatory outputs. To avoid this, the implementation of fairness and bias in the development of the AI tools is important. Next, then privacy and data protection. As AI systems are developed by using the patient data, this data may include the patient informations, medical images, radiation treatment record, dosimetric data, diagnostic report, and clinical histories. In medical or the bioethical point of view, the improper handling of this sensitive data or of patient data may affect the confidentiality and which violate the AI ethics standard of the ethics principle. In India, we are following ICMR 23 and 2017 guideline for this. Next, next is the accountability. The principle of accountability and ethical governance are essential for medical physicists. Responsibility of varying the AI generated recommendation and maintaining the patient's safety throughout the RT workflow and distribution of the accountability from D to D means from development to deployments. So there is one life cycle of the AI tool, how the AI tool is generated and where deployment in the clinical practices, and end user will be a medical physicist or radiation oncologist. So from the development of the AI model, initially you need the data. If data is biased, the outcome will be a bias. Then we use or we there is a teamwork. So work of the AI engineers, then researcher, then who analyze this data, data collector, and then deployments. During the deployment, end user will be a medical physicist or radiation oncology. For example, if you are using an AI based model in the quality assurance and it predict or it's analyze the output in the wrong way, then the entire treatment will be affected by the wrong output. Then who will be responsible? The medical physicist will be responsible, company provider responsible, researcher responsible, or the AI engineer who work for development this model, who will be responsible. So for this thing, AI governance is working. They are distributing the role and responsibility of the individuals among the life cycle of the AI model generations from from development to deployment. So they will distribute the responsibility, and end responsibility will be distributed to a medical physicist. Like if you find out any AI based output, the responsibility of medical physicist to analyze this data whether the AI output is right or wrong, or this is correct or not. So end user can finalize the application of this model. Next. And another one of the most essential principle of the AI ethics for the medical physicist is the human oversight and the professional responsibility. In accountability, we discuss about the distribution of the responsibility among the individual or practitioners. But if AI-based decision that involve the treatment planning or the dose calculations or the imaging prediction or QA that directly affected to patients, and in the clinical practices, role and responsibility will be remains and the end user, that is the medical physicist, even after the AI generated tools are integrated in the radiotherapy workflow. If the wrong AI recommendation may lead to a treatment error or the inaccurate treatment delivery, the role of the medical physicist is essential to review the AI generated output, ensure the compliance and with the clinical safety standard. So human oversight will be there, as we if we are practicing the AI tool in the routine practices. Still, there will be a role of the physicist, and the responsibility of physicist will be there to analyze, to check the safety protocols, to check the transparency of this model or transparency of AI tools, and most important, the safety of that AI tool. It should not affect the safe clinical practice or our patients. Next, please. So recently, TCS 83 and IAA Human Health Series 50 was launched. This is work IAA, IAA has provided these two guidelines recently. So TCS 83 provide about how we can integrate the AI, what is the need of the AI ethics in medical physics curricula, practices, or the for the research also. And Human Health Series provide the application of this gap, how we can implement this AI ethics principle in our routine practices. So it provides some recommendations that I have discussed here. For example, the AI should function as the assistive tool. They mention that the AI should be function as the assistive tool. It should not be directly replaced to the medical physicist. And it is also recommended we need the quality assurance. For the example, if we are the qualified medical physicist, and we have to monitor the QA program for the AI system, because AI implement or their performance may be a degree over the time due to the change in the clinical data, image protocol, and patient population. So we need to upgrade the AI model also, because the new data will be generated. Based on data, remodification of the model is also required. So role of the medical physicist to monitor and quality assurance of this model in the routine practices. Next. So these are the some expected role and responsibility of medical physics in the era of artificial intelligence. Like the medical physicist can and their responsibility can be a technical evaluation, then risk assessment, then quality assurance of the AI model or AI generated outputs, and clinical validation. For example, any XYZ company has launched an AI model, but really it is feasible to work in clinical practices. For example, it is working in India, will be working in Indonesia or other region or other territory. So we need the clinical validation of the model which is specified to the geographic locations, because the data we are using to generate or to train this model may be different from the different countries or different region. But we need the validations of this model, and role of the medical physicist whether this model is working in your institute or in your country, this is important. Then workflow of integration, assessment of the clinical challenges, which for example, if you're facing any challenges, we can collect all these challenges together and from the another guidelines. So it will be help to reduce the unintended exposure or unethical practice or any problem which is related with the AI tools, and we can determine, analyze, and provide the solutions based on the analysis or assessment of the clinical challenges while integrating of this model during the daily practices and determine. Okay, no, no, okay, fine, yeah. Next. And medical physicists will be responsible for testing the AI system to verify its compatibility and its safety. But it will be a possible if this will be a part of the AI ethics governance, and regulatory body will implement such things like the AI governance, then it will be a responsibility for the medical physicist to testing their system and verify its compatibility. Participation is also important in the procurement of the or procurement decision, evaluating the technical specification, then uh, cybersecurity and long-term maintenance, quality assurance, how we can do the quality assurance. So all these factors are important, and it may be and expected to be this role and responsibility of medical physics in the era of artificial intelligence. Next. So medical physics may ensure that clinicians understand the capabilities and limitations, like the what are the benefits and risk factor of the AI tool, to prevent the misuse and misinterpretation of the AI generated outputs. So it will be a important things, and medical physics are expected to establish the routine performance checks or the quality assurance. They can monitor the system accuracy and evaluate the clinical impact and identifying the unexpected errors and bias. So these are expected role and responsibility of medical physics in the point of view of the AI ethics. Next. Last but not least, this is the one of the part like the governance of the AI. So AI ethics and governance provide the principle that practice, like the governance is practiced with the guideline and aim to AI to be safe, and it is provide the guidelines and policies for the protecting the human rights to ensure them throughout the process of the AI integration in the RT practices. So ethical governance, oversight, and support the compliance with the legal and regulatory statement, and that is standard concern about the patient data or data privacy and responsible use of the AI technology in the clinical practices. It can establish the ethical governance which further enhance the medical physicist confidence that promoting the trust on the AI based system when we will implement in the routine practices. An ethical safeguard will help to prevent unintended events such as the incorrect or inaccurate prediction, radiation delivery, and unsafe automation in radiation therapy workflow. So, ethical governance will provide the guidelines for the safe practice of AI ethics and shaping the role of medical physics in the era of AI in future point of view. So AI ethics governance is integration with the medical physics. It is essential for future point of view. Uh, Next, I think, thank you, thank you so much.
Thank you, Shira. And is there any question? Please drop it in a chat box, or else you can unmute your mic. You can ask the questions.
You can invite noise.
Yes. And really, thank you, Sriram ji. Uh, really, there are a lot of key takeaways. Yeah, please. You can unmute your mic, Dr. Ro.
Hello.
Yes.
Yes, sir, good morning, sir. It was such a nice presentation. It's actually current scenarios need actually. Actually, just I would just want to one clarification or not clarification, just a suggestion from your side. When we are drafting any article or writing any scientific literature, what will be the AI the publisher should accept?
Uh,
Allow
okay.
this much AI will be accepted. Like a like a income should not be more than 10%, something like that. So what is the criteria, any guideline or any rule book where we can see AI should be not more than this much?
Actually, currently there is no straight or clear statement about this much we are accepting. But as we observe, some journal asks for the declaration that you have used the large language model during the drafting. So, consent they are asked for the same. And I think up to 10% will be a much better. Likewise, our plagiarism. But anyway,
Yes.
yeah, yeah, yes. If you write, they're always finding of the same thing. Anyway, any large language model is developed based on the our data. I have seen so many paper. If we read the paper before the 30 years ago, they use some common words and all these words are collected by the LLM model. If even you are writing the something without the AI model, there will be a 1 or 2% it will show the this is AI generated. So I think up to 10 may be feasible. But currently there is no exact clear statement that this much we are accepting.
Right, sir.
Uh, Thank you, sir.
Thank you, sir. Thank you.
If you obtain any question later on, you can email me.
Yes, sir. Sure, sure. Sure.
If anybody having
Yeah,
any
can you can
question
you
or
give me? Yeah, Shriram can you give some insight on? See, most of us really right now using AI contouring
hmm.
generally. So, how we can like validate it and develop it, and which model? What are the AI governance says that? Like how we can methodically approach that part, AI contouring.
uh, Actually, so now for this purpose, we are using some well-developed algorithm which is already developed and trained, and we can initially take the trial on institute. For example, if you are approaching with any company, they are going to launch the one AI-based contour contouring tool. You can practice this in the different region of the India. For example, if you are taking the 4 or 5 hospital from North India, South, East and West India, and you can validate their experiences from the user. For example, how the oncologist observe their user, they are really drawing the heart properly or not. So there will be a qualitative and quantitative analysis is also available. There are some method in quantitative analysis, and qualitative analysis is also important. So based on this experience, you can determine this applicability in the region.
Okay, fine, that's fine. Thank you.
Yes.
Mhm.
If in future, if anybody is having any question related with the application of all this tool in clinical practices, you can email me or you can drop me message on LinkedIn, because your one question can becomes another research gap for all of us, and it
I
will be
have,
your contribution for yes.
I have a question, please.
Yes.
Okay, thank you for the contents of hair ethics well presented. I really uh enjoyed the presentation. Thank you very much. So I
Thank
just need more clarification on the application of AI in radiology diagnostic department. If someone wants to specialize as a clinically certified medical physicist in a radiology department, so the diagnostic aspect, medical physics can work uh, uh, as a in a the aspect of medical physics working in a radiotherapy and in diagnostic session. So how can I use it if I want to specialize in diagnostic session? How can I or what areas that I can use AI? Thank you.
uh, okay. So you are asking about how you can integrate the AI in radiation diagnostic.
Yes.
Okay. Okay. So I have read about the one paper there that was mentioned that the in diagnostic radiology, some report has been generated by AI tools. And if, for example, if there are the disease or there may be any other patches, how the AI will identify the exact what is the disease and what is the patches in that CT image. And I have seen so many applications, like they reduce the noise and improve the image quality. But except the such advantage, there are risk factor, how the AI is exactly predicting the disease. Are they really providing the correct data for analyzing this report or providing the report? So for this need, can uh, we can develop the any guideline for the safe practice. For this purpose need some study we have to conduct in that region, and some principle we can implement in the routine practices. How, if for example any report is generated, diagnostic final report, then how we can uh, yeah, yes sir, I think Lohar, yes sir, want to share something.
Yes, sir. Just want to continue with your answer actually. It's a superb question basically. As a medical physicist, if you ask me, we as a medical physicist are having there around six AI project as a PhD project under me. These scholars are doing PhD under me, and they're having six project, and we are working on different AI modules. I can give the example like if you know the thecal sac, the thecal sac measurement used to be done manually when you go for this MRI and CT um, measurement. But we have developed some kind of AI tool by means of which you can easily get by a single click all the entire dimension over there. So here, medical physicists will put the physics and the AI particular knowledge over there and give the one special feature into a equipment or the CT or you can say CT or the MRI by means of which their workload may get reduced. So the actual the research, what is the validation of this particular tool is going on right now. Second one, the lung volume actually we are trying to measure. Some calcification also we are trying to measure with the help of some AI tool. Apart from that, some cancer tumor delineation kind of thing we are trying to measure. So as the medical purposes, yes, we have a lot of options to get incorporated not only in therapy but also in the diagnostic aspect also. And the contouring, what you discussed right now, contouring is like no, sorry, so not contouring, that reporting. Reporting is solely the area of radiologist where the image interpretation has to be done. So it is quite like we have less chance over there. We have less kind of say over there because we cannot, I would say, make the things that much close to the interpretation what exactly the radiologist used to say. But yes, if any part inside the, you can say the chest X-ray, inside the chest X-ray, we can check for the pleural effusion. You can check for some kind of calcification, or you can check for some lamination or something. You can check for like this what corona that dots if you can able to coincide things. So these are the way how the medical physicists can really work hard in the medical diagnostic aspect also to make it what to say more powerful for the upcoming generation.
Yes, sir. I am agree with you. If we see the beginning from the radiology or medical physics journey, so medical physics from the beginning play an important role. For example, for first time comes the treatment planning system. Before there was the manual calculation. So from beginning to till date, medical physics is playing the important role in diagnostic and therapeutic part. And we
Yes, sir.
for future point of view, we have to welcome the AI models, but
Yes, sir.
our concern is related that it should be a responsible. We know that there are several advantage, but we have to consider the risk factor, and by integrating the AI ethics it will be a responsible. So that is the concern point from my side.
Yes, sir. It's a
Thank
need
you,
of
Sriramji,
the
and thank you, Lugaria, Dr. Lugaria and Robert. Yes, it's time to close the session. If there is any further questions, we can mail it to Dr. Sriram Rajukar. We'll take it upon that. And is there any further question? We can accept one more questions from any participants. Yeah. Then thank you. There is a one key takeaway for the medical physicists is to understand that the AI governance, it's really great insight given by Sriram Rajukar, like the D&D from the development to deployment. So each medical physicist should understand if you are like installing and deploying any new AI tool, we should know who will be accountable if the AI makes the accommodation wrong. So development to deployment, AI governance clearly give a guidelines like roles and responsibilities. So we have to follow it to the heart. Uh, Thank you to that, Sriram Rajukar.
Uh,
It's really helpful. And thank you all the participants for joining for today's session. Hope it will be very useful and discussion is very informative to everyone. Thank you then. Thank you, Rajukar.
thank you all
Yeah,
of you, and thanks for giving me this opportunity. Thank you.
great. Thank you then. I will
Thank you.
close the session. Can drop the question in the chat box or in the email to Mr. Sriram Rajukar as well.